Healthcare is absolutely vulnerable for a variety of reasons. One is that cyber criminals have figured out there's a treasure trove of data here that they can get at and monetize very quickly, either through fraud, doing actual medical claims fraud, or stealing the identities and going that way. Another thing that they can do is if they have an axe to grind, so if they've decided from a hacktivism standpoint that they want to send a message, they can try and hack into the equipment, hack into the hospital systems, look at things like changing blood types, doing things that would create a lack of confidence in America's healthcare system. I think this is a tough realization to have set in. A lot of times people think, oh, if I buy new technology or if I've bought security technology, that means I'm protected, that means I'm safe, and it doesn't. It's just like putting a home security system on your house. It means a large alarm will go off, but it doesn't mean that you're safe. It's just another barrier to entry that may deter some thieves and may stop some, but some will still get through. And I think that's really the realization that CEOs and boards need to have, which is every piece of technology, new and old, is hackable. And candidly, we haven't met technology we couldn't hack into for less than $1 million. Security has to be tied to the business goals. What business problems are you trying to solve? And how does security help you solve those problems better, faster, cheaper? That needs to be the conversation. A great way to get the board and the CEOs on board is to be tied to the business goals. Another great best practice is to actually ask the board to carve out 30 minutes of a board meeting to practice a digital disaster. Nothing hits home faster than a real scenario being played out and seeing what might happen and how unprepared you might be. Obviously, nobody wants to get breached. And so the best way to prevent a breach or to recover quickly from a breach when it does happen is you need a cybersecurity program. That program has to be people, process, and technology. You really want to be thinking about your education and awareness program, not just for your staff. It has to be for vendors, and it has to be for your customers, whether those are the patients or the doctors, whatever part of the chain that you're in, whoever your end customer is, they have to be part of the neighborhood watch too. Technology is very important, but it's the last piece that you put in place after you think about people and process.